So one of our favorite systems, and something that's very easy for all of you to put into play as soon as possible. Is everyone here computerized? Everyone on some kind of practice management software? Anybody still on paper? Nobody. Good, thank God. Okay. So if you have any kind of practice management software, you can block schedule. And let me tell you why this is a great system. How many of you in this room are administrators? Okay, good. We have a bunch. How stressful is it when you've got a day that is jam-packed with production and good things, and everybody was excited in the morning huddle about how full that day is, and the phone rings at 9:30, and it's an emergency. So you figure out a place to stick that one in, and then the phone rings again at 9:45, and it's another emergency, and you don't have any spots left. How stressful is that for you as an administrator to try to figure out where to put that patient? So now what do you have to do? You have to walk in to the treatment room with a Post-it note or whatever your signal system is, tap the assistant or the doctor on the shoulder, and say, where do you want me to put this person? Right? And now the doctor has to break away from the heads that they have in front of them and the tooth that they're working on and try to look at the schedule behind them and point and tell you where to put that person. That's not a good system. It's very disruptive for the administrative team. It's extremely disruptive, and it sends a terrible message, one of the worst messages that we can send to the patient that's in the chair receiving care at that moment. And it's also sometimes very disruptive for the hygienist or the assistant or whomever else may be affected by that change that was now made in the schedule. So we want to start to schedule for production and not for busyness, and we'll talk about how we're going to do that. So if you were to visualize a big empty glass jar, a pickle jar, mayonnaise jar, and we thought about rocks being our highest production procedures, our pebbles being our low production procedures, and our sand being our no production procedures. If I asked you all to take that empty glass jar and fill it up to the top with sand, and then I said, okay, now put some rocks in there, would they fit? No. No way. Okay, so empty it back out again. So we know we can't fill the days up with sand. That doesn't work. Empty it back out. Now I'm going to ask you all again, put some pebbles in there. Now, if you want to fit fake sand around the pebbles, certainly you can shake that sand in there and make them fit, but you're still not going to fit any rocks. Right, everybody following so far? Yeah. So if we empty it one more time, and we look at every day like an empty glass jar, and we decide that moving forward, we are going to predetermine where our rocks go. And we are going to allocate time for rocks. And rocks are going to be things like, your high production procedures, obviously, but your rocks should also be your new patient times that should be pre-blocked, particularly in some of our practices that are a little bit busier now, and definitely your emergency time, because that can turn into anything. So we want to pre-block that time and not violate it. So I know that the next thing that everyone's going to say is, well, what if 2 days before I have a 2-hour opening and I have not been able to fill it with a rock? Doctor's going to lose his or her mind. If you get to the 48-hour mark or the 24-hour mark and that block has not been filled, you now have carte blanche to put whatever you want in there. You're not going to hold it until the last 5 minutes. At some point, you're going to give it up for whatever you can put in there. The next obstacle or sort of rebuttal that I face when I present this is, what if people don't want the blocks of time that I give them? Well, guess what? We're going to talk more about how to make that happen. There is a way to convince people to take the times that are actually better for us, with them thinking that they're better for them. We'll talk more about that later. But you can also flip blocks. So let's say on Tuesday, your high production block is in the morning and the afternoon is supposed to be for sand. If you have someone that wants to do a 6-unit bridge on Tuesday afternoon, you're going to move that block down to the afternoon, and now the morning is sand. So there is some flexibility there. But just to get a template going, I do suggest that all of you go back to your office, use your practice management. If you're using Easy Dental or Dentrix or PracticeWorks, it's in there. SoftDent, I'm not sure if you can set a template. Mogo, I definitely don't think you can. But either way, you can come up with basically on paper what you want every day to look like. Your read is going to be your high production time, you're going to have low production time, new patient, etc. Once you get that on paper and everyone understands what they're working toward, if you can lock it into your practice management software to do it. If you can't, just know that that's your guideline. And you will be amazed at how well this helps to create balance. The other reason why we want to do this is, again, to keep that perfect culture and that feeling of harmony, to make the days as stress-free as possible, and to create a balance and a flow. How many times do we go in the morning and we have what we call an energy sucker day, where you have 100 little 30-minute appointments all day long? You leave at the end of the day and you're ready to commit suicide because you're so tired and so stressed out. You look at the daily numbers, they're really not great. Everybody's mad, somebody missed lunch, somebody forgot to take the garbage out. It's like the end of the world day.
We call that side book. Homicide or suicide?
Homicide or suicide, that's the one. So what do we like to do instead? We want to try to create balance where we have those perfect days where we've met or exceeded our production goals. And the way that we create these blocks should be based on your production goals, which hopefully you all have. And that way we come in, we hit our production goals or exceed them. We have harmony, we have balance, we're not spinning our wheels and running ourselves ragged, and we're fulfilled at the end of the day because we accomplished great things. So that's the other reason why we want to do block scheduling. I do also encourage you in the practices that are doing more soft tissue management and things like that, you should definitely block schedule your hygienist. Block schedule for your perio treatments.
And when you're block scheduling, we're not going to get a chance to talk to it much tonight, but we're a firm believer in bonus systems, but meaningful bonus systems where people on the team know what it is that they have to achieve in order to earn a bonus. Bonuses are for ABCD, above and beyond call of duty. And if you structure each day in a way that you have a production goal that is attainable, then you're ensuring, we talked about before, making things that are satisfying to the team. Certainly, being able to achieve a meaningful bonus is something that would be satisfying to just about everybody here. It also creates an environment where it allows us to improve the access that we give to our patients. You know, we didn't talk much about the economy tonight, but we're always hearing that there are 10% of the people who are out of work. Well, that means 90% of the people are working. But of those 90% that are working, work has become more difficult for everyone, and the demands on people in their jobs are greater. So it may be that some people are not able to leave their job in the middle of the day to have their dental care done. In order to improve the access, what we recommend doing is opening up your office to times that are convenient for the patient. So it's not out of the ordinary in our office to ask the patient if it would make it convenient for them. Would it be helpful to come in at 6:30 in the morning so they could get 2 hours of work done before they got on the train? Well, you may say that that's crazy, but if we are accommodating patients like that, and the assistant knows that by coming in at that time in the morning, being asked, not told, we never tell the patient that the team to come in that early, we ask them if they're available and would they be willing to come in. And if they are willing to come in, they're going to get paid time and a half or double time to come in those early hours. And if we've had a productive appointment between 6:30 or 7 o'clock and 8:30, we've done maybe a 3-unit bridge or a root canal post in the crown, then how much closer are we to reaching our goal for the day, which will trigger their bonus so that everybody in the office makes more money? And so in our office, we create a culture where if we wear headsets, and I'll say over on my headset, Mr. Jones would be interested in coming in early. Is there anybody who would be willing to come in early one morning next week? And I'll usually get 2 or 3 people saying, I can do it, I can do it, I'll do it. And then we have to decide that we have to divvy out to coming in early so that they can help the office become more profitable, and they can achieve higher bonuses, and the patients feel that they were treated special, that we really care about them, that we're willing to go out on a limb to make it accessible to their care, and it just is a win-win for everybody involved.